Hey, what's up guys? Good morning. It's Kevin again from PedalPT out here in Portland, Oregon. Want to take a little bit of a moment. One of the most common things we tend to see in the clinic that we talk about with riders out on the road is back pain. Back pain with cycling. It's probably one of the most common things that we see. Second only maybe to neck pain, knee pain, are probably the top three pain complaints that we tend to see when it comes to bike fit. So I want to talk a little bit about what generally, these are generalizations, generally causes low back pain, or some things to kind of consider when you're evaluating yourself on the bike, or if you're helping another rider, things like that. So first thing that we go through is a lot of times that we will tend to run into people with back pain. The number one thing that we tend to see is the saddle is too high. Why is that important? Well, if we've got a bike and we're pedaling, and as we reach the bottom of that pedal stroke with our legs as we're reaching, if that saddle is too high and we're going to reach too far at the bottom of our pedal stroke, our hips and our pelvis will begin to reach toward that side that's, on that longer side. So as we pedal lower leg, the hips then start to rock, and all this kind of combined side bending, side bending, side bending, side bending as we continue to pedal typically leads to stress strain to the ligaments of the back, to the joints, to the SI joint, things of that nature. That's one of the most common things we tend to see is saddles too high. All of us have been riding behind people and they see those hips rocking back and forth each time that they're pedaling, and it's kind of like a little mini side bend as well. This is usually accompanied with what we'd call a kind of too much lumbar flexion or too much lower back flexion, or what we call a posterior pelvic tilt. So let me try to demonstrate that for you guys so you can see what I'm talking about. But when we look at a cycling position, the main thing we want to look at is almost like a squat, or as we were going to do a deadlift. As we sit our butt back, our back stays flat. This stays straight, and then we're on the bike, and this is kind of how we typically would focus on riding on that bike. If we're riding the bike and we tend to roll our pelvis down, so now we're rounded, all that kind of rounding and stretching of the muscles and stretching of the ligaments typically leads to back pain if we are going to maintain this position for presumably hours and numerous pedal strokes as well. So again, typically if our reach is too far, if we're reaching too far for the handlebars, that's going to also cause us to round a little bit more. And the more rounded we are, the more at risk we are for back pain. Why is that the case? Well, when we are rounded, and we're all rounded over like that, our muscles kind of act a little bit like, the best analogy I always use is that the muscles act like Velcro. Follow me on this, okay? So if you've got Velcro and you've got a good overlap of that Velcro on one another, we've got a very strong bond, and that Velcro is actually quite stiff and quite tight, okay? And that will hold a good amount of load. If the Velcro, however, is just kind of held on just a little bit, just like that tip of the edge, all of a sudden you're not going to get as much performance out of that Velcro, and that's kind of the way your muscles work. When we are a little bit flatter, we're backwards bending our spine a little bit, those muscles overlap and they kind of protect the back, and we're actually using those muscles then to stabilize us and hold us there. But when we are all stretched out like that, those muscles can't generate a lot of force, so they don't protect the spine, which a lot of times leads to pain on the bike. So that would be kind of the top things. It's a lot of times saddle too high, you're reaching too far, and a lot of times it's just, sometimes it has to do with saddle comfort as well. You will kind of tend to do that posterior pelvic tilt to get pressure off the front of the saddle. Or let's say the saddle is a little nose down. A lot of times you would have to, in order to get your weight backwards on that saddle that's nose down, you're gonna roll back to try to keep your weight back there. And again, the more we roll and round that lower back, the more vulnerable we are for back injury. Vice versa, if the saddle is nose up too much, so we're getting a lot of pressure on the anterior portion, or kind of in the front of the groin, we're gonna then roll our pelvis to get off of that saddle, therefore a lot of times leading to back pain as well. So a lot of times the back pain itself will come about from sometimes compensation regarding other things. So I guess the take home from this is that you want your spine to be straight. We want to be able to roll that pelvis forward and keep our back roughly flat. If you're riding with riders and you tend to see they are very rounded in the lower back and are complaining of back pain, we're probably dealing with a combination of maybe a saddle position issue, saddle height issue, saddle tilt up and down, or the bike is perhaps just a little too big for them, et cetera, et cetera. There's a lot of different factors that we can kind of play with. But saddle too high, also just Understanding another thing that we tend to see with back pain that has nothing to do with bike fit at all is actually the cadence that you're pedaling at, or how quickly, how fast you're pedaling as well. The faster you're pedaling, generally speaking, the less stress up the body. The best way of thinking of that is, I'm gonna curl, I'm gonna hand you a 10-pound weight and you have to do a bicep curl with that 10-pound weight. If you're gonna do that curl 10 pounds versus on your other hand, you're gonna do 40 pounds. You're lifting heavier versus the lighter weight at 10 pounds. That's kind of the same thing what happens when we are pushing a very hard gear, pedaling very slow, very low cadence. That would be more like 40 pounds versus spinning at a high rate, somewhere between 80, 90 to 100 revolutions per minute when we're pedaling. That's kind of like slow reps and easy, simple reps. The harder that you're pushing, the lower cadence, typically the more your spine cannot hold that force. So let me try to describe this one as well. This is another kind of tricky one to get down, but we're here as we push with our legs to push down into those pedals. If we cannot maintain this position, the push is going to result in us rounding. Almost as if you were going to be, on a leg press. Let's say you're going to put your leg up on a leg press. You've got a pad behind your back, and as you push your feet into that leg press, your back wants to round forward, but because of that pad, it blocks you. When we're on the bike and we're flipped over on that position, we need those back muscles and those ab muscles to hold ourselves stable. And if they fatigue out, a lot of times with climbing, things like that will cause back pain. Sometimes it's the inability to tolerate that amount of torque for the legs, for the back to be able to support that, for the musculature to be able to hold on to that as well. So kind of some fun things to think about. There's a variety of things to check out. As physical therapists, we can really evaluate your back, find out where the pain's coming from, give you some exercises, stretches to remedy the back pain, and also be able to combine that with the bike fit to kind of help you guys feel better on the bike. But anyway, I hope this was valuable for you guys. If you do have questions at all, go ahead and leave some comments down there. I'll try to answer those as quick as I can. And otherwise, that's kind of your general reasons why we tend to get lower back pain on the bike. Thanks, guys. Cheers.